So this image that you're looking at, I think is like a marionette doll, those dolls that are held together with strings. And if you pull the string, it sort of tightens everything together. It brings all the joints together. And when you loosen it, they can be kind of loose and floppy. So that's the image I want you to have for this lesson. And one of the reasons I drew the picture, which I'm going to put with the CDs now, is so that I think there are different dolls, string wooden dolls like this, so I wanted you to kind of know which one of those string wooden dolls I was talking about for the lesson that we're doing. And also just, take a look at it and look for yourself where the major joints in your body are. Obviously I didn't differentiate toes and fingers. But you'll see, instead of just one solid trunk, there's a trunk and then there's that lower part. Does anybody know what that lower part is for? That's the pelvis, yeah. So I thought that was important enough to distinguish in our self-body image. Okay, so this lesson also is mostly, although maybe not completely, depending on how you interpret the directions, a visualization lesson. So we'll be lying on our backs the whole time. And as always, that means if you need to bend your knees at some point, bend your knees. It means if you need to take a break and just lie on your side, then to do that. Always the lessons are in the parameters of self-care, whatever that means for you, because I think most of us have lost touch with true self-care, true listening to our bodies and adjusting so that we're being kind to ourselves. Okay, so lying on your backs and really connecting to each of the parts of your body and how they are lying on the floor. First, just feeling the back of your head and noticing the connection, how your neck connects your head to your trunk. And you can feel your head as its own separate headedness. Or you can feel it connected through the neck into the trunk via the spine. And you can feel your body, the body of your trunk lying here, the back of your shoulder blades, the back of your ribs, your waist. You can notice in your own trunk if you lean a little leftward or rightward, if there's more pressure on one side than the other. And then sense your pelvis, which really is an extension of your trunk, but has its own set of parameters. The triangle sacrum bone in the back, the buttocks and gluteal muscles, your pelvic floor region, your lower abdomen that we often refer to for breathing into your lower abdomen below your belly button. So this is your whole pelvic region. And sense just your thigh on the right and on the left. So the longest bone in your body is your femur. That would be your thigh bone. You can have a sense of how this connects via the hip joint to the pelvis. Notice if there's more clarity in how you observe either side, the left or the right side. And then you pass through the knee joint to get to the lower leg, where there's two bones. The tibia is your shin bone, and the fibula is a little bone on the outside towards the back. So you can sense the upper leg, the thigh, and then the knee joint, and then the lower leg. Its own part of the body. And then through the ankle joint and the foot. Again, feeling the right foot and the left foot. The weight of the heels of the right and left. And then bringing your attention back up to your arms and feeling just the upper arm on the left and right sides. The upper arm bone is the humerus. That's why your elbow has a funny bone, because it's at the end of the humerus bone. Some scientists were having fun one day. And then down to your forearm, the lower arm, which, similar to the leg, has two bones in it. The radius and the ulna. So you get that lovely movement of being able to bring your hand facing upward and downward. Can either come from a rotation in the shoulder joint or a rotation in the elbow joints. And then, of course, there's your wrist joint down to your hand, the multiple bones of your hand, but for the purpose of this lesson, we'll just let it be the hand on the right and the hand on the left. So bring your attention down to your right foot and lower leg. Well, actually, first, let's imagine the marionette string going throughout your body. So imagine as though you have a string coming down into the top of your head, coming all the way through your trunk, and then it splits. It splits in your pelvis down your right leg and down your left leg. And it connects the trunk to the pelvis, through the right hip, through the right knee, through the right ankle to the foot. And it connects from the top of the head, connects the head to the trunk, to the pelvis, and then down through the left hip, to the upper leg, through the left knee, to the lower leg, and to the left ankle. And then the string also splits just below the neck, going through the shoulder joint, to the upper arm, through the elbow joint, to the lower right arm, and keeping the hand from falling off. And then splitting down into the left upper arm, and the left lower arm, and to the hand. And just sort of have a sense of all of your parts lying here. And the string right now is fairly loose. But you could imagine if somebody were to just lightly pull on the string at the top of your head, how it would just gently snug up all the joints. It would snug your trunk up to your neck and your pelvis to your trunk. Snug a little bit in your hips and your knees and your ankles, your shoulders, your elbows, and your hands. And imagine letting that string go and just letting some space come back to all of the joints. And then let's just go through one at a time. Really imagining that somebody were to come up to your right foot and just pull the right foot outward, downward, just a little bit away from the lower right leg, and still letting it rest and sit on the floor, but the right foot has just been, there's just a little gap now in the ankle between the right foot and the right lower leg. And just lie there, imagining what that feels like. And then you can imagine, again, someone just lightly pulling on the string above your head, and your foot just comes right back into place. The gap goes away at the ankle joint, and your foot fits snugly. Not tightly, not crankily, but just a nice snug fit of your foot back to your lower leg. And then imagine that a few times, just having somebody lightly pull your right foot away from your lower leg. And you might even create just a very subtle movement in your body that represents what that would be like to have a little bit of distraction, a little bit of space between your right foot and your right lower leg. And then a snugging back up with that gentle tug of the string. And follow up your right leg, imagining first that your foot is pulled away from the lower leg, and then that there's a little space to gap your right knee so that your right lower leg just lightly gets pulled a little bit away from your right thigh. So now there's a gap in your right knee and there's a gap in your right ankle. And just play with those gaps. Play with that imagination of the string pulling at the top of your head, snugging the knee joint and the ankle joint back together, and then softening and loosening so the gap can come back to the spaces in the joints of the right knee and ankle. And then on up to the right hip joint. So starting with feeling the gap between the right foot and the lower leg, and then as if somebody were just lightly pulling your lower leg to gap at the knee, and then just a little pull at the right thigh. There's a gap in the hip joint. And then as you imagine someone pulling the string at the top of your head, which joint snugly fits first? Do you go hip, knee, ankle, and then everything's sort of back in place? Or do you go ankle, knee, hip? You can play with those two images. And just feel the alternating sort of lengthening with creating more gap between each joint, and then shortening. And you can even find some very small muscles within yourself to activate, to actively help shorten your leg again, to actively help just bring those joints back into approximation. And then just pause with the imaginary movements in your right leg, and just feel, if really not having done any movement at all, but lying here, do you sense your right leg any differently than your left leg as it rests here on the mat? If you were going to kick one leg up in the air, would one leg be easier or lighter to kick up in the air than the other leg? And if you want, you could even try it. You could even try just sort of lifting and lowering one leg and the other leg, and just seeing if there's any differences between the sides that are unexpected. And you can lift it with your leg straight, or you can bend your knee, however you imagine the string holding you together. Good. And then just coming to rest again. You might roll your head a little bit left and right. Again, feeling how your right leg is resting and how your left leg is resting. Sensing the string connecting all your joints together. And then bringing your attention down the left leg as we did with the right leg. And starting with the left ankle and just imagining that the left foot is gently pulled slightly away from the lower leg and there's just a nice little gap there. And just pause there. What's that like to feel and sense that imaginary gap? And then what do you do to snug it back up? Is it completely in your imagination, or are there just little teeny muscle contractions when you pull your ankle to snug it back up with your lower leg? And then bringing your attention to your left knee. And just gapping the left knee a little bit. You can either gap the left ankle first and then the left knee. You can just imagine that little gap in the left knee as if somebody was just lightly pulling your lower leg just a little bit away from your thigh. Just a little space, a little breathing room. All the synovial juices can get in there and bathe that knee joint. And then snugging it back up. And then bringing the attention to the left hip joint as it connects right up into the pelvis. And just to see how many of you really know where that left hip joint is located in the front of you? Let's just do a quick check. So place your hands where you think your left hip joint is. And now my patients will discern themselves from my non-patients. So your hip joints are, there's lots of interesting places. When we put our hands on our hips, we're really putting our hands on our waists. And that's really your pelvis. So your hip joint is located, if you were to bend your left knee and hip, and that crease that you're making, that's where the hip joint is, right in the middle of that crease that you've just made. Yeah. So the thigh bone comes up, kind of out to the side. There's sort of a bump on the outside of your thigh, but then it angles in to make that hip joint. So when you're imagining the gap in your hip joint, that's where you're taking your imagination. I'm just now remembering my fantasy of bringing the skeleton to show you where your hip joints were, but here we are. Does everybody feel comfortable with that? Got a better, clearer idea? So again, gapping in that hip joint, gapping the knee, the ankle, and imagining that string, just pulling them all together. And it's kind of a nice idea if you just imagine a little bit of swishing in those joints, because the way your joints stay healthy is through joint fluid. It's called synovial fluid. And if we're not having good, healthy synovial fluid, then that's when we kind of get the crunching in our joints. More often knees, sometimes hips. And so in this activity, if you really sort of imagine that there's a little bit of fluid swishing and squishing as you lengthen your leg and gap the joint and snug it back together, I believe those visualizations can be really healthy in accentuating the true fluid motion that is there. And then what if you were to do both legs at the same time? What if you were to gap both feet, gapping the ankles, so taking both feet away from the lower legs, and then imagine both of the feet getting drawn back snugly into the ankle joints to connect with the lower legs. So doing that several times, gapping and closing the gap. And then imagining the knees gapping. Somebody lightly pulling your lower legs away from your thighs, little knee gap, and then snugging it back up. Just lengthening and shortening, but as if you could do it just at the knee joint. And bringing your attention up to the hip joints. And then just resting, feeling each of your legs lying here now. If you felt an asymmetry earlier, has that evened out? Is there more commonality between how the two legs feel, or maybe they're even more asymmetrical as you get in touch with the differences? Does one leg gap and snug differently than the other leg? And then just try lifting your legs again, either with your leg long or bending your knee, but see if that's changing at all. That sense of just being that light wooden marionette, as if somebody was just picking up the string so that your leg pops up and pops back down. Wouldn't that be nice at the end of the day? We could just pull a string and our legs keep moving us around. Good. And go ahead and bend your knees for a moment, letting your feet be flat on the floor, and just very gently rock your knees a little bit side to side and roll your head a little bit. Just let your body get some movement, some circulation. This is how I tell who's fallen asleep. You're all doing very well. And bring them back down long again. And just with your arms resting at your side, just really sense your right arm and your left arm. Sense the weight of each arm. If you were to make a guess of which arm, if I were to walk over and pick up each of your arms, which arm would feel heavier? Which arm would lift heavier? Does one arm seem a little longer or shorter to you? Even maybe one arm's a little closer to your body or further away. Let's start with the left arm this time. Actually, before we start, just lightly lift your left arm up and lower it. Feel the weight of your left arm. Just 2 or 3 times. And then the right arm. Just a couple inches off the floor, just to feel how it lifts and lowers. And then bringing your attention down to your left hand, and just as we did with your leg and your feet, just imagining your hand being separated just slightly away from your forearm, as if somebody just pulled on it, that string lengthened a little bit and there's a little gap in your wrist. And someone gently tugs on the string out the top of your head, and your hand just fits ever so nicely back into your forearm through your wrist. Just use that imagination several times, just feeling the lengthening and then the coming back to approximation through the joint. And as you're doing it, you might even feel, is it completely straight? Does the hand come in a completely linear direction out from the wrist, or does it maybe go a little left or right, or maybe there's a little rotation, maybe as it pulls away from the forearm, in your imagination it turns a little upward or downward. Because after all, you are not stick people, nor are you one-dimensional. So how much of your own three-dimensionality can you feel in these movements? Bringing your attention to your left elbow. Imagining the lower arm being pulled very lightly away from the upper arm. Sensing the gap. Sensing any rotations or angles or just interesting things that you might not have thought would have happened, but then all of a sudden you sense it in your imagination. And snugging it back up several times, gapping and snugging, letting the string lengthen, pulling the string, letting it bring your forearm to your elbow, your hand to your forearm. And then bringing your attention up to your left shoulder. How many of us don't want just a little bit of space in those shoulders, huh? Upper back. So just feel, imagine that little pull on the upper arm, lengthening the upper arm, taking the weight of the arm off the shoulders and neck, feeling that little gap, and then pulling the string in your imagination and just letting the left arm lightly come back into contact with the shoulder, into the trunk. Gapping and snugging. I think there's these little snap-it toys, but I think that's too harsh of an image to actually imagine unsnapping your shoulder and snapping it back in. So we'll stick with the marionette. Unless you can use that image and be very fun and playful with it. Not feel like you're dislocating anything in your imagination. And just let the whole left arm get long gaps between the wrist and the elbow and the shoulder, and then shortening it again, lengthening and shortening. And shifting your attention. Feel how your right arm is resting on the floor now compared to your left arm. Just with these visual images, has anything changed in your sensory experience of how your arms are resting? You can lightly lift your left arm up and let it flop back down to the floor. And then try your right arm, seeing if anything's begun to change. And then shift your attention to your right arm, gapping the hand from the forearm. You can even imagine seeing the space. It's interesting, some of us will actually be looking down at ourselves and looking at the gap between our wrist and our forearm. And then some of us will be really just lying in our bodies feeling it. So just notice if you're watching, imagining, watching yourself creating gaps, or if you're actually feeling gaps inside of the self that is lying here. then several times gapping and ungapping the elbow on the right. Really feeling that space. Again, noticing if there's any rotational components or the three-dimensionality of the front of your elbow and the back, each of the sides. And then bringing your attention on up to your shoulder joint. Again, as if somebody's pulling on your right arm and just taking the whole weight of your arm off your shoulders, your upper back, and your neck. And then just very lightly pulling the string and reconnecting the arm. So lengthening now the whole right arm, the shoulder, the elbow, the wrist. Pulling the string and snugging all the joints back together. And noticing, do they all snug together at once, simultaneously in your imagination, or which one goes first? Is it wrist, elbow, shoulder for some of you? Gap it again, and maybe when you snug it up, it's shoulder, elbow, wrist. And then just sense your right and your left sides lying here, each of your arms and each of your legs. You can lift your right arm and just let it flop back down to the floor, and your left arm, your right leg and your left leg. Is anything changing? Nice. Good. And bend your knees up. Let your knees rock a little bit right and left. Take your head the opposite direction. If you want to really have a great time, take your eyes opposite your head. That's how we have fun in Feldenkrais. Good. Nice. And if it's comfortable for you, bring your legs back down long. So let's try going up the trunk a little further. And I think if we start down with both feet gapping from the lower legs, gapping at the knees from the thighs gapping at the hips from the pelvis. And then imagining a little gap between the pelvis and the rest of the trunk. So the gap might kind of happen between the pelvis and the lower back. You feel where the lower back curves a little bit, maybe. So just imagine that gap. And then imagine bringing the pelvis back into connection with the trunk. And you can either let the legs stay long in their gapped position, or you can let everything gap and then reconnect as the string draws everything back together again. So many of the people I see with low back pain have become so tight in that connection, really, between the low back and the pelvis. So just having this image of lengthening back there, creating a little gap, and then just snugging it up very lightly and gently. And then what if you gap the low back from the trunk And then you also imagine the head, a little gap between the head and the trunk, so somewhere in the neck. So the pelvis and the head have just created a little space between the trunk. And then when you pull the string, everything's lightly, firmly though, supportedly connected. Gapping, space, pelvis to low back, upper back to the head, and connecting. And then what if, like the marionette, the string was really loose and everything gapped? Ankles, knees, hips, pelvis to low back, neck, shoulders, elbows, wrists. So just imagine yourself just sort of laying there in parts. And then lightly the string gets pulled and blah, 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 blah. Everything connects. And then it spreads out this spacious, sort of a disconnected, but in a connected sort of way. And then everything just snugging back up. And when you snug everything back up, when you bring all the joints back together, is it, again, completely in your imagination? Or are there little minute muscles contracting and supporting the bringing of those joints back together? And what if we just did the right side? What if you just gapped the right ankle, knee, hip, shoulder, elbow, wrist, and then pulled the string and snugged everything back up again on the right, doing that several times, lengthening and snugging. And then maybe try the left side a few times, gapping the left ankle, the left knee, hip, the left wrist and elbow and shoulder, and feeling that string pull and everything on the left side reconnected. And when you do that again, do you feel a very linear, sort of a stick figure connection in yourself, or do you feel rotations? Do you feel the nuances of your own three-dimensionality? And then what if you were to alternate? Lengthen and gap everything on the left side and snug it up. And then lengthen and gap everything on the right side and snug it up. And do you see it all at once? Some people will sort of see or feel all the gaps at once on one side, while other people will be very linear. They'll talk themselves through the ankle, the knee, the hip, the wrist, the elbow, the shoulder. Just notice what your style is. Or you might have another style that I don't have, so I haven't thought of it. And then what if you were to gap the joints in the right leg and the left arm? So the right ankle, the right knee, the right hip, the left wrist, left elbow, left shoulder, and snug those up. And try that a few times. Right leg, left arm. And then try switching, gapping the left leg, hip, knee, and ankle, and the right arm. And let it all go. Lift up one arm, flop it back down, and the other arm. Let it flop one leg, the other leg, different parts, maybe an arm and a leg, maybe your head, but don't flop your head. No head flopping. Let it all rest. And then just a couple last times, do everything. Both ankles, knees, hips, pelvis from the back, head from the neck, shoulders, elbows, wrists, and lightly bring it all back together. Maybe when you pull everything back together, it will be more perfectly fitted than before. You keep gapping and swooshing the fluids in the joints. They're going to feel better than before. So a few more lengthenings and snugging ups. And then just take a moment and just feel yourself lying here, your head. How do you sense your trunk now? Your right and your left arms. Each of your legs. And in your own time, in your own way, take your time to roll all the way to your side. And I really encourage you, instead of doing a partial sit-up where you tighten everything in the front of your chest and your abdomen, really let your front stay soft by rolling to your side and then sitting up. Take as much time as you need to come to standing and just really play with the sensations of standing. And then walking, we'll share our experiences, and we'll have a wonderful Marionette